We've reached day 4 of Exponential Medicine 2018, the last day of the conference. Let's give a quick review of some of the highlights in the presentation. It starts, of course, the morning after the midterm elections, and during the discussion, there was mention, by Peter that intellectual property and capital is no longer confined to political boundaries. And one of the important things, of course, is trying to create incentives from an economic and legal perspective where companies will want to found themselves in America and in your state and not go to other jurisdictions. He also commented a lot about the education of children, which is an area regarding huge incentives for disruption. A lot of what we're taught to our kids, isn't directly usable in real life. And he kind of emphasized 3 things. 1, the critical importance of helping children find their passion. 2, helping them understand how to ask very good questions, because we're now moving into an era where it's actually where it's very easy to find the answer to many questions, and therefore knowing to know what the question to ask is actually more important. And the 3rd is, of course, grit and perseverance. The first section was on augmenting biology and reversing aging. A lot of interesting work being done in this area. The first was Andrew Pelling from his lab discussing this idea of mechanical biology, which is that cells in natural environments undergo a certain amount of mechanical change. For instance, as you breathe or move, your cells very slightly stretch and shrink. And this influence of mechanical forces seems to actually affect how the genome is expressed within the cell. For instance, they can look at some cells which are normal in certain environments, and then when subjugated to stretching, may actually mutate or transform in that they become more rapidly oncogenic. There was the other question about how do cells, how are they affected by shape? And he did some experiments in the lab placing cells in different shaped containers and found that they would actually reorientate their scaffolding based on these factors. In his lab, what they ended up doing is actually going and being wondered about how we could build better bioscaffolds to do regenerative medicine and tissue engineering. And what they did is they went and found some apples, and they decellularized the apples, meaning that you remove all the cellular material and you're left with the extracellular matrix of that apple fiber. And they then planted cells on that extracellular matrix and found that it worked quite well as a growth scaffold. And therefore, they went and cut apples, which they bought at the grocery market, into the shapes of ears, used them to grow human cells, and then implanted those human-grown organisms into mice to see how they responded, and actually were taken up very well by the mouse bodies, looking like they, under the microscope, were innervated properly by mouse cells and blood vessels. This process involves no stem cells, it involves no growth factors, it's fully organic, it's biodegradable in theory, and it offers, interesting opportunities for the future of bioscaffoldings in this area of regenerative medicine. So their lab right now is focusing on bone, cartilage, and spinal cord nerve repair. And the way that his lab works is, very much focused on encouraging people to simply be curious and rigorous in their ideas. So the curiosity can lead to very eccentric and strange ideas, such as purchasing apples to use as your bioscaffolding. But the rigor is the crucial part of actually ensuring that scientific method is applied, and then you're able to validate whether this out there idea works or not. The next presentation was by Amy Wagers, who's a PhD in stem cell and regenerative biology, and she uses a technique called Parabiosis, which involves placing mice, essentially joining them side by side together. And you can do different combinations of parabiosis, such as combining a young with an old mouse, or an old with an old, or a young with a young. And this allows you to study the effects of having different types of cells within an environment, such as mixing old cells into the environment with new cells. And from her work, specifically looking at GDF1, she's found multiple age-related phenotypes based on blood-borne factors, trying to figure out, of course, which factors are most responsible for aging. GDF1, as I mentioned, is one of the primary ones which is being looked at, and it seems to be very important in the functioning of healthy tissue. And there's also, of course, work with metformin on how it can influence people's lifespan. And finally, try to understand how we can use this not only as a biomarker, but by understanding its mechanism, potentially develop a therapeutic which could be dose and context dependent in order to help extend life. Peter Diamandis, Bob Hariri gave a presentation from more the X Prize and Cellularity company perspective. There is, optimism that will be the opportunity to extend people's lives by potentially 10 or 20 years with technologies which are being developed right now. And this would be, very impressive as far as being able to transform society, the way we think about work and culture, for instance. This graph here shows the degradation of different body systems: eye capacity, blood flow, breathing, hearing, cardiovascular, nerve conduction over time. And as we see, there's a decrease in the functional capacity of these systems as one ages. Some systems decline at much more rapid rates, and the hope is that with regenerative therapy, we'd be able to prevent or slow this rate of decline. The work that Bob is doing with cellularity is, of course, focused on trying to fix areas of muscle mass, neurodegenerative and cognitive decline, immune system dysfunction, useful aesthetics, and extended lifespan. Part of their approach is trying to understand how to use placental stem cells in order to do this. Placenta stem cells don't need to be matched to donors because they don't induce a allergic or rejection response. And the thought is that as one ages, the dysfunction associated with these different systems, muscles, bones, brain, seems to be correlated with loss of stem cells, both in quality and quantity, which is partly driving their thesis. And so they've been trying to suggest how administration of these placental-derived stem cells is able to extend survival in mouse model. I think it was mouse models that they're still using. We move on to David Caro from Human Longevity Inc. He's the CEO there. And Human Longevity right now has put 3,000 people through their system. And as we discussed in video yesterday or the day before, you come in, they send you for some lab tests, you get whole genome sequencing, calcium CT, whole body MRI, body composition, brain MRI, and then they combine all this together to create results. And what they're hoping is that this will be the next leap forward in helping extend human lifespan. When we look back over the last century, we see that we've had increases in the percentage of people living to the age of 85. In the 1900s, only 5% of people lived to age 85. In 2010, 45% of people lived to age 85. Their hope is in the future that many, many more will. And right now, it's very interesting to see just how dramatically the cost has come down on the services that they're offering. In 2015, when they first started, it would cost at least $12,000 just for the testing which was performed at the center, and that cost has come down in the last 3 years to now $5,000, and it's predicted to be $1,600 within 2 years' time, and by the middle of this coming decade to be in the area of $500, which is pretty mainstream, because what they're doing is, again, full body MRI, CT labs, and whole genome sequencing. It is also worth pointing out that the $5,000 is for the first visit, and then if you came on an annual basis, it would be $3,000 each subsequent year, of which these costs are actually below their market cost. The $5,000, for instance, because of the other costs required to run their operation. It more just covers the actual industry sequencing costs and imaging costs when you're billed. What you get in return is a personalized risk score, personalized score on how to reduce your risk, and then understanding of how that risk was determined. And the thought is that the combination of both MRI with genetics is able to better predict outcomes than either of these independently. And for instance, in this case, they're able to predict dementia 10 years prior to disease onset, which is trying to tie into the fact that multiple therapeutics are being developed to slow or prevent the onset of dementia. And last, this is an example of a personalized health report. In this case, you had a person with a very high genetic risk for, I think it was dementia. And though when they did the MRI, the brain looked quantitatively normal. And therefore, they said that the person probably just has a mildly elevated risk compared to the baseline population, giving the fact that the brain MRI looked reasonably normal compared to the absolute genetic risk. And so they suggested that reduction of this person's BMI and would further reduce his risk. Now, Osman Kurbar, the CEO of SamuMed, gave a very interesting presentation. I think this is probably the one which really shocked a lot of people this morning. This is a company valued at $13 billion. It's currently still private, and they're focused on restorative medicine. And this is looking at degenerative diseases, oncology, and inflammatory conditions. And it's kind of amazing what they're able to do. They're looking at the Wnt pathway, that's WNT, and I'll just start off by showing what they're doing in human clinical trials. So they're injecting therapeutics which are able to manipulate the Wnt pathway, and when injected into a damaged knee, it actually would restore that knee under the microscope to a not only as good as it was before the knee got damaged, but even better than a normal knee for that age. This was the results within 3 months from a single intra-articular injection in a rat model. The reason that these cells actually ended up growing back thicker and better than prior to the cartilage being damaged was that the progenitor stem cells induce new adult cells, meaning that you're getting a fresh layer of youthful cells in an area where previously they had aged before. Now, this was, as I mentioned, a rat model, but I think these next ones are in actual phase 2 trials. This one here with degenerative disc disease is actually in phase 1. The pictures shown are rat discs, where you have a degenerative, very damaged vertebral disc injected with the Wnt pathway modification, and then the disc becomes healthy yet again. We see the same with tendon repair. Tendon repair is currently going to be starting a phase 2 trial at the end of this year. We see this also being done on cancers with plans for phase 2 and 3 trials in 2019. And we see those who've been treated have had better outcomes in tumor volume than all the others which haven't. And this is seen across colorectal, pancreatic, liver, gastric, ovarian, lung, endometrial cancers, in human tumors, in mouse xenografts. And they've currently finished phase 1 dose safety trials. They've so far given this to 1,000 human subjects with no adverse events recorded to date or drug interactions. They also are working with Alzheimer's disease. Currently, they're going to be completing their phase 1 trial in 2019 for this. But again, showing that it is able to remove all of the plaques from underlying Alzheimer's. And they've also been looking to use this for regenerating hair, removing wrinkles, removing scarring in the lungs, such as fibrosis. And their thought is that this is kind of a spare parts business, that when a piece of, for instance, cartilage in your knee wears out, that you would be able to go in and repair it. And they call this not anti-aging, but de-aging therapy, because it doesn't only stop aging, but actually reverses it. And the way that this works is that in our body, we have embryonic stem cells, which then develop progenitor stem cells being those which still remain in our body after we are born. And those progenitor stem cells then develop our adult cells, such as the adult dermal or adult epithelial or mesenchymal cells. And that's what derives and replenishes our bones and hair or skin. And the Wnt pathway is the pathway which regulates, it's been studied for over 3 decades, the progenitor cells as they move into adult stem cells and adult cells. And we'll see, where this work goes. Daniel Kraft showed his marrow miner he's been working on for a few years, which is a way to essentially get a single trochanter into the iliac crest, and then by using a flexible component, it's able to scoop out the marrow inside of the iliac crest much faster than having to take multiple painful draws. There was a discussion about the future of healthcare with some individuals from Deloitte and Amazon Web Services. There was discussion about technology and global health. And that is a wrap. I'll be posting, I think, next just a single summary of maybe some of the top ideas overall from the last 4 days.